The rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH-LP 103.5 FM, your home for community radio.
Good morning, everybody, and good morning, Harry. That melodious voice you heard is our station manager for WNHH 103.5 FM, and I always like to kind of just acknowledge folks that help these productions happen. We have people on the stage, people on the screen, people on the Zoom, but nothing happens unless you have teamwork, so I always like to kind of thank Harry and Ashley Paul Bass, who it's his vision through the New Haven Independent to have secured this FCC low power license to have a radio station here in New Haven that really, I think, broadcasts, I know, has content and information that really is of interest to people worldwide. And thanks to Zoom and the internet, we're able to broadcast beyond New Haven and even to discuss events and activities and situations that pertain to the globe. And really, in fact, in terms of COVID-19, we're going to talk today about things that are affecting the globe from a COVID-19 perspective, and have experts and people that are dedicated to sharing with us what COVID-19 means, not necessarily today on Monday, April 12th, but for the future. What about people that have survived COVID? Are there any after effects? What about people that might be in your home that have survived COVID, and what kind of things to be on the lookout for? So in terms of the disease treatment, in terms of how do we really deal and recognize and keep our body and mind and spirit whole moving forward under this COVID-19 pandemic is something we're going to discuss. I'm really pleased to have two doctors with us, Dr. Arjun Venkatesh and Dr. Erica Spatz, who are joining us along with two of the Yale Center for Clinical Investigation Cultural Ambassadors, Reverend Perry and Reverend Clayton. And they're going to talk about the impact of COVID-19. You may have heard something about something called long haulers or long COVID in communities of color, and how that might impact communities of color and the elderly. So we're going to speak about diagnosis, treatment, and what they are doing. That is Dr. Venkatesh and Dr. Spatz. What are they doing to understand the disease in our community? Welcome, everybody. Good morning. How's everybody doing?
Doing fine.
Hi, thanks for having us.
Dr. Venkatesh, you have a long title and as Associate Professor in Chief Section of Administration. I'm not going to go into the other word behind your name, but we'll deal with that during our next 50 minutes. But tell us about your role in emergency medicine care at Yale. People they know about the building, they know about doctors, they know about emergency rooms, but to hear emergency medicine, and then not only just those two words, but the care, emergency medicine care at Yale. Share with us a little bit about that.
Sure, thanks, Tom. And let me first say, thank you for having me, and credit and kudos to you all for the work you all do, sort of getting the word out and ensuring there's a dialogue on these important issues in our community. So I came to Yale about 8 years ago, and I had never really been to Connecticut ever before. I thought I'd be in and out in a couple of years. Next thing I know, I joke with people, I've lived in New Haven, now I'm in Hamden. It's been 8 years. I got 2 kids in a house and going nowhere. And I have been part of emergency medicine, the emergency department here ever since. And in my role, at Yale, we have 3 emergency departments. We've got the sort of main academic campus downtown. Many people know it on York Street. The St. Raphael's campus joined our group several years ago over on Chapel Street. And then we run a freestanding emergency department out in Guilford. And so when I think of all the different hats I get to wear here and all the work I get to do, my favorite job is still working down in the ER. And our 3 ERs together every year take care of about 200,000 folks across the New Haven community. In the COVID pandemic, I have been part of co-leading our response to that. And that has been the whole spectrum of things you could imagine. On one end, it is trying to think how in the emergency department we take care of patients who are sort of the most sick when it comes to COVID, those that require ventilators for breathing or anything on the spectrum of care, to the other end of it, which is folks who may have developed a fever and are concerned that they might have COVID and are trying to find access to testing. And now increasingly, fortunately, we're in a position where we're trying to help direct people towards accessing vaccination. And so the emergency department, in many ways, I always say, is it's for a lot of communities, it's the touch point for everything in healthcare. And so we have tried in any way possible. We're always sort of under tremendous stress as a system, but to sort of be that open door to the community and help create those access points for different kinds of care so that people get the right care at the right time.
So important, so important. So you have about 5 or 6 different heads and hats and fingers and extra toes, and you're growing extra.
Yeah, you know, it's a fun job. I get to work down in the ER clinically. I'm responsible for sort of new quality and safety related initiatives we have across all of our EDs. I'm also a researcher, and so when I wear my research hat, I do a lot of work trying to think about how we can improve the quality and value of healthcare people get, both across the country, working with the folks down in DC at Medicare and Medicaid. But I also do here, and sort of very relevant to our conversation today, where I work with Dr. Spatz on a project where the Center for Disease Control and Prevention, the CDC, funded us to really dig into this idea of long COVID and start understanding what's happening in COVID. You know, if you'd asked me 2 years ago, I'd never heard of coronaviruses for the most part, never really thought about them much, except for the little cold that me or my little kids would get. And now they've become central to all of our lives. And so in that same way, I've tried to move some of my research to try to deal with the biggest problems we've got in our world today.
So important, so important. Dr. Spatz, how are you doing this morning?
I'm great, Tom. Thanks so much for having me.
It's just good to see you. I don't think we've met before, but it's good to see your face, your smiling face. You're a director of the Preventive Cardiovascular Health Program at Yale, and that's a mouthful. Director of Preventative Cardiovascular Health Program. What's that all about?
Right. So my career has really been dedicated to preventing heart disease and stroke, both at the individual level as well as in the community. And so I came to New Haven about 12 years ago through the Clinical Scholars Program. And in that context, the way that they trained me and Dr. Arjun Venkatesh, who you have here, as well as really hundreds of other people who came to New Haven is in how to work with the community to improve health. And so my area of interest has been in how do we prevent heart disease? How do we prevent stroke? And when we look in the community, and as COVID-19 has laid bare, there are enormous health inequities within our system. And my interest and my passion is in trying to invest in the structural changes that are necessary and partner with community members, with health system leaders, with patients to figure out best practices for helping people live their healthiest lives. So last year, Yale invested in a program based out of the section of cardiology to improve cardiovascular health. And I'm honored to be its inaugural director. I've been working with the associate director, Dr. Oyeri Onuma, who's a cardiologist and close colleague, to really create a vision for this program. And there are essentially 3 pillars that we are really sort of banging hard on to maximize impact for patients and for the community. So those 3 pillars are personalized medicine. So bringing together people's biology and their biography, where they live, what their experiences are, into the conversation, into the way that we evaluate people's risk for heart disease and stroke, and into the tools and care that we provide to improve cardiovascular health. The second is really integrating digital health tools. So taking advantage of apps and devices and all things that young people and older people are using to improve health, to reduce those barriers and to make care more accessible and to make it sticky, to make it relevant to what people are challenged with in their day-to-day world. And the third is really just, again, emphasizing the importance of community partnerships. I think that we need to think about healthcare as extending way beyond the 4 walls of the hospital and really bringing care into the communities where people can easily access care and find trusted members of their community who can help to facilitate those relationships between the health system and patients. I think we feel the urgency of that right now related to COVID, but the underlying problems within our health system have existed for a long time and have created the situation that we're in for COVID. And I think that we can't address COVID without addressing the other aspects of health inequities in our community, most of which relate to cardiovascular disease.
Fascinating. And just hearing both of you speak, even if COVID had never appeared, it seems to me that you guys would have been are pretty busy anyway. So this is just really fascinating. Let's move to COVID or what people might call long COVID. And Dr. Venkatesh, is this just a slang phrase when we hear this term long COVID, or is it something that we really have to deal with? And what is it? And even people talk about post-COVID, post-acute COVID-19. Break that down to us a little bit from a layperson standpoint. Are these phrases important? There's something we should be on the lookout for?
Yeah, they're absolutely important. I think the reason you hear so many different names for it is that we're so early still in many ways in this pandemic and understanding it that we're not exactly sure what to call it. Here's what we do know. We know that some proportion of folks that get COVID still have symptoms longer. Most people I get to see in the emergency department that have mild COVID, I tell them, hey, it's going to be worse than the flu. You're going to be doubled over with some fevers and cough. Who knows what it is, different kind of symptoms for different folks. But usually most people in a couple weeks, you get better. You get over it. What we're finding, though, is that there's a meaningful number of people out there who those first 2-3 weeks go by and they still have some symptoms. Few months go by, they still have some symptoms. What's challenging about it is that there's no sort of one kind of symptom that people get. What you find is that there are some people who are still having some chest pain 2 months, 3 months later. Other people call it shortness of breath or fatigue. Other people feel like it's a memory problem. They can't remember stuff as well. They kind of feel like they're in a fog. And what we don't know is this all the same thing, or are these all different things? And so that's why I say in some ways it feels like we're getting over this pandemic, we're beating it. We have made remarkable strides, as a nation over the course of the last year. But when it comes to something like long COVID, we're still in the early stages of it. If you're out there, you're listening to the radio or reading the news, you might have heard it first called, a lot of people called it long haulers. And that just comes from the fact that I think a lot of the people that really engaged on this, patients around the country, had a lot of kind of ties to the trucking industry. And there's, I think, an actual truck driver who had some long symptoms. They called himself a long hauler up front. And so that word turned into long COVID sort of meant the same thing. It doesn't necessarily mean you have a COVID infection. You're not running around with the ability to infect other people with COVID. You don't have an active virus in you, but what you have is long-term symptoms after having a COVID infection. And then the whole new term that's getting used around this is post-acute sequelae, things like that. That's just a fancy science word for it. I think right now, if you're listening to this show, the first thing to be reassured by is that most people, almost everybody, still gets better, but that there's a subset of us that seem to have some sort of lingering symptoms or lingering reaction to that initial COVID infection. And those are the folks that we're trying to identify for research. Those are the folks we're trying to learn from. Those are the folks that, we really are in the early stages of trying to figure out what it is.
This is so important. Just hearing you talk, it seems to me we're going to have to do another show on this, because this might be an evolving issue for at least the near term, in terms of as you guys continue to collect research data, et cetera. Dr. Venkatesh, for someone that's just joining in and might have missed the really, I think, important, when you listed some of the possible symptoms, repeat some of those again, if you would.
Sure. I think what people often forget is that COVID itself, if you go and see what the CDC says now, I think they've got almost 12 or 13 different symptoms that could be your first symptoms of COVID. And so there's no fewer symptoms that could also be your symptoms of long COVID. And so regardless of what kind of COVID version or COVID infection you felt like you had, some people had more fever, some people get more cough, some people get more short of breath and fatigued. A lot of people get a mix of all these things. Some people lose their sense of smell. That's probably the one, I know that one, people definitely remember that one when they have that one. long COVID is really folks who have either a persistence of those symptoms or pick up some new symptoms after their initial infection that keep lasting for, weeks to months after. We don't have an exact number. Like, I can't tell you that, if you've had symptoms for 3 or 4 weeks, you have long COVID. We don't have a hard definition like that. Right now, what we're generally saying when you look at some of the studies out there is people who have symptoms for more than 3 weeks, those are folks that we need to be able to take another look at. Those are people that we need to be engaging in the healthcare system, because if they haven't gotten better in that first 3 weeks, it's possible they're going to have longer term symptoms. What we don't know is sort of how long are they going to last. And I'll just use a quick example. One of my best friends from residency, when I was training to be an ER doc, is an ER doc down in Atlanta. And he had a really mild COVID infection back in July. Unfortunately, got sick on the front lines of this pandemic, but never ended up in the hospital. He had a fever. He stuck himself down in the basement of his house for a couple of weeks. Didn't get to play with his kids, anything like that. Then came out, and what he noticed was now, almost 5 months later, he still gets fatigued or short of breath with really any major kind of exertion. He can't work an 8-hour ER shift anymore, because after about 3 or 4 hours, he's just sort of too tired to get up and be able to, walk around the emergency department. He feels like his memory's a little bit off, and he's a little foggy talking to patients. And it's totally impacted his life. He was, kind of guy who would run a 5K before all this happened and never been in a hospital except for work in his life. And so I bring that up because there's not a perfect example of what this is, and we don't know how long it's going to last. He's doing better now than he was 2 months ago, but he's still not back to normal. And so we still have a lot to learn. Like you said, I know a lot more about this today than I knew 3 months ago. I'm hoping that we know a lot more 3 months from now than we do today.
Fascinating. And again, I just want to mention to folks that we're not here to scare a person, and we're not here to really intimidate, but just to really lay out some facts that I think really important, that you may have gotten your two shots and feel healthy, but just to share information and be aware. And if you know of someone that survived COVID, kind of ask them how they're doing, reach out to them. I've heard Dr. Vindicash say that some people, that there's something called that they're experiencing brain fog. Can COVID-19 cause brain damage?
So I think brain damage is a really scary term. And I don't think we have any evidence to suggest that it's causing brain damage in that way since then. When I think of the term things like brain damage, I'm thinking about people who have things called strokes, or they're in a major car crash and they've got an injury to their brain. There are things that people have heard about, things like Alzheimer's disease and things like that as you age, where you can really have sort of damage to the brain. This is different in some sense, in that what people are sort of describing are symptoms we sort of associate with our brain, things like our memory, things like our alertness, our attention, and they feel like they've got trouble with it. There are many people sometimes who've had a concussion will have similar type of symptoms after they've had a concussion. And sometimes people have symptoms for a few months after concussion, where they sort of say, I feel like I'm slow, or I felt like I'm forgetting things, or I don't feel as sharp as I was before. It's hard to know, actually, if this is all from COVID too, because we all have made major changes in our lives. I think everybody has felt that, everything we've had to do as a community to sort of fight COVID, which means not making as many connections with our loved ones, often being at home and alone, working from home, whatever it might be. There's many isolating sort of aspects to COVID. And we know that folks' mental health has been very fragile through the pandemic. And so one of the things we have to try to figure out and tease out are some of these things that we're feeling, and some of these both either mental health effects or memory effects and different kind of cognitive effects, is that part of COVID life, or is it part of something related to that initial infection? And so, like you said before, I think if you're feeling like this, reach out, get help, connect with your healthcare team, your providers. We're going to learn about this as this sort of goes on. But I don't want people out there to feel like, COVID's attacking their brain or something like that. That's definitely not the case.
That's right. Just how things are so interconnected. It's really, really fascinating. Dr. Spatz, as associate professor of medicine, and you're a cardiologist, rumor has it. Is that the case? Will you hold up your diploma? Can I see your? Well, I'll accept that you're legit. But can COVID-19 do anything to the heart?
Sure. So COVID can affect the heart. And early on, we were most concerned about a diagnosis called myocarditis, which means inflammation of the heart muscle. So this condition can affect the heart's function. It could also put people at risk for life-threatening arrhythmias. And this was the main concern that COVID would potentially impact. And we've heard about myocarditis as it relates to people in the hospital, as well as even young people like athletes. So one of the main concerns that you'll see both in professional sports as well as collegiate athletes is, has COVID caused myocarditis? Because in athletes, it can be particularly dangerous. An athlete who has myocarditis and who's competing at a very high level, both asking a lot of workload from their heart, as well as having a lot of adrenaline running through their body, can put athletes who have myocarditis at risk for very significant severe outcomes, including sudden death. Fortunately, Tom, though, it's turning out that myocarditis is pretty rare, although it's still top of mind. So when somebody comes with any kind of symptoms like chest pain or shortness of breath, we always have to think, you know, let's get rid of the worst case scenario first. And worst case scenario, most people do recover from myocarditis, but we need to take specific precautions. Once that's off the list, Tom, we are seeing a lot of potential effects on the cardiovascular system. And when I say cardiovascular system, I mean not just the heart, but all the blood vessels that deliver oxygen to our muscles. And we are really struggling to understand what's causing a lot of these long hauler symptoms. So people are coming weeks and months later after having an infection with COVID and describing, as Dr. Venkatesh was saying, you know, I'm having chest pain, I'm having shortness of breath. I feel like I go to walk and my heart rate is just climbing through the roof. It's as if I go to sprint. It's as if I've sprinted. What is going on? And so we've been doing a lot of tests, and for the most part, Tom, these tests are coming out normal. But what we are sort of finding is that the body's regulation and adaptation to exercise is sort of messed up. You know, that the ways the body is so complex, and the ways that, you know, oxygen is delivered to muscle tissue is probably affected. The way that we regulate our heart rate, the way that we regulate our sleep cycles are all sort of disrupted. We've been putting this under an umbrella term called autonomic dysfunction, which really gets to these very diffuse processes in the body that can be dysregulated. And so our tests aren't great to really hone in on the specifics of what's causing these long hauler symptoms. But we think that there is some general dysregulation in the body that relates to the autonomic nervous system. And I'm happy to go more into the autonomic nervous system in a moment. But I think it also speaks to us, how do we then treat this? How do we get people better? And one of the things that's been super interesting for me is the opportunity to work with people who are pulmonologists, so lung specialists, physical therapists who are helping people to rehabilitate, and neurologists who are seeing people who have brain fog, and putting our heads together to really understand a very complex group of symptoms that are happening, probably without one specific cause. And then how do we create recovery programs that help people get back to health? What does that look like when people go to rehab? Does it need to be different from your standard rehabilitation therapy? And that's what we've been meeting together around and working on, and working across with colleagues across the country and across the world to really understand how best to diagnose and treat long hauler symptoms.
So it really is we hear this term multidisciplinary approach. It really is an intersectionality, multidisciplinary approach to kind of reaching the best solution.
That's right, Tom. I don't think I could do this work or anyone could do this work in isolation. This is a complex disease. It has complex symptoms, and we need more research in this area. We need for the people that are most affected by COVID to participate in that research so that our findings and the scientific discovery is relevant and impactful in the people that are affected by this. So it's a real call to action, Tom, that we as a community, not just as a medical community, but really as a society, need to come together around to understand what are the long-term effects of COVID as they relate to the body, the physical aspects, the emotional and mental aspects, the social aspects. How do we better understand this, and how do we design strategies to, again, bring people back to health?
And Dr. Ventukash, any comments in that regard?
No, I think it's, it's interesting. When we go to medical school and you pick what kind of doctor you want to be, and you go to this long training and residency and fellowship, and you sort of get this lens of sort of one part of the body off. I'm always thinking about emergency medicine. We treat every part of the body, but I'm really good at emergencies. I don't know a whole lot about long-term management of chronic diseases. Dr. Spatz, trained to be a cardiologist. She's not a pulmonologist or a lung doctor or a brain surgeon. But that's not the kind of problems people have, right? People don't walk in the door with I've only got a heart problem right now, or I only have an emergency problem right now. I think we need to treat kind of the whole person. And what we're learning in COVID is maybe in some ways teaching us this as a healthcare system, and hopefully helping us collaborate, build new teams, and build new kind of healthcare in a way that's much more patient-centered, is to say that, somebody's got a whole host of symptoms that's affecting their life in a bunch of different ways. We've got to try to find a way to connect those dots. And like she said, I think the most important thing right now is people are afraid. I get that. They're afraid of COVID. They're afraid of, getting hospitalized with COVID, terrible things from COVID. They hear about this long COVID. They get afraid of that too. Is to remember that we're still very much in the early learning stages of this. This isn't like any other thing you see your doctor about, where they say, oh, you've got high blood pressure. We've been doing research on that for 40 years. We think you should take this medication. And let's make a plan around it. This is something where we're building the plane and flying it at the same time. And so I think participating in research, being part of sort of that community, it means that you're gonna be part of not only figuring it out for yourself, but you're also sort of part of figuring it out for everybody else around you, as we do this work. And it's going fast. Research for this it's not like the high blood pressure where we spent decades on it. This is going at light speed, just like the vaccines did. And so I think it's important to sort of, rise to the occasion for all of us in the community.
Tremendous. Just before I go to, we have the Yale Center for Clinical Investigation. We have two of the cultural ambassadors with us, Reverend Perry and Reverend Clayton. And just before I come to them, I just wanted to ask, but both doctors, we're still in the midst of this situation. And I was in a meeting last week, and the person there says, I'm not going to get the vaccine. My friends are not going to get it. My mother's gotten it, but I'm not going to get it. Talked about the need for vaccinations, and not to lambaste anybody or shame anybody, but I was just struck. I was just really knocked off. I was struck. I just couldn't believe it. And these were friends that were saying that they're not going to do it and not even get tested. What do you say to someone that wants to wait to see if they wait about the results of the vaccines, or even? I can't even finish the sentence. It gets me so upset.
Yeah, no, I understand. And I feel you, Tom, but I say I get it because, nothing like this has sort of turned our entire life upside down. And so we're walking around, I get it, feeling more nervous than certain things are moving fast. It's all brand new. And there's a million reasons why people would feel hesitant about a vaccine. I often tell people that, we have to avoid overthinking it. It's not about the 100 reasons why you may or may not want to do something. It's about the reason you do want to do something. And, I'm pretty young. I don't have any other medical comorbidities. I'm not at higher risk of necessarily ending up in the hospital with COVID. But a lot of folks in our communities aren't. It doesn't matter how old you are. I think what we're learning now with this latest wave of COVID is that as a lot of older folks in many communities have been vaccinated and younger people are the ones who are getting COVID, they are also often getting hospitalization. I worked last night till 2 a.m. I admitted 3 people, all under the age of 40, to the hospital on high levels of oxygen because they got coronavirus. 2 of them didn't have a medical problem in the world. One of them's only, I think, medical condition was that they smoked cigarettes. And so I think that it's real, and it's easy to feel invincible when you're young. But I think we have to have a healthy dose of respect for COVID. And even if you do feel like you're going to beat COVID, me personally, one of my reasons to get vaccinated was because I didn't want to get long COVID. Like you asked us earlier, what can we do about this? We still are working on trying to figure out what long COVID is and how to treat it. But one thing I do know is that to get long COVID, you had to have COVID in the first place. And the best way to not get COVID in the first place is to get vaccinated. And so for me, it's like I mentioned, I was talking to my buddy down in Atlanta, who's a doc down there. I couldn't imagine kind of months and months of symptoms and facing that long term. And for me, that was one of my big drivers to get vaccinated early on, was that if I got vaccinated, I'd keep my family safe, and I personally wouldn't end up getting long COVID someday. And so I think everybody's just got to find their reason, find their one thing, that one thing that sort of motivates them the most. But this is a good one for a lot of people.
To say the least.
Yeah.
Dr. Spatz, I see you're nodding your head.
Yeah, I think we are all eager to return to normalcy. I need for my kids to go back to school for my own sanity, for their own well-being, and I need for their teachers to feel safe doing so. In order for our society to get back to itself, we need people to be vaccinated. And I think what Arjun is saying is totally right. Find that one reason and go do it, because the science shows us that the vaccines are safe. They're a heck of a lot safer than getting COVID and potentially ending up in the hospital and dying, or being left with these long hauler symptoms that prevent you from doing your job. At the end of the day, it's preventing people from working and getting back to their life. So I think we find that one reason and we go for it. With the rise of new variants from the UK, from Brazil, from South Africa, the vaccines are ever more important, because we need to build up an immunity within our society to prevent these variants from running rampant, and then leading to a third wave of shutdowns, because that is ultimately what will happen. I think we have to also make vaccines easy. It has to be like the easy default. I go to my doctor, I go to my church, I go to my community center, and the vaccines are there. So we make it the default. We don't make it so complicated to get online and wait, and so much decision making and effort has to go into that. Let's just make it easy. Let's get the supplies are increasing. Let's get it out into the community. Let's see people who look like me, who are champions of this, doing it for themselves. And maybe it's not such a big deal to do it for your own self or for your family.
Excellent. Well, I'm going to send the link to this show to the people I was chatting with last week, and hopefully they'll listen. Reverend Perry and Reverend Clayton, you two have been very patient, and you're patient men, you're humble men, but you're also very aggressive men. And I say aggressive in a good way, because when you're passionate about something, you realize that the urgency is always. I mean, you believe in the eternal realities, but you also understand that the 24/7, 365 existence is very important. Anything you'd like to share at this stage, Reverend Perry? Reverend Perry, you're on mute.
I was saying, Tom, I think this is why we do this show, because it is so important that this information is shared. I mean, information is where the lag is in terms of why we do things and why we don't. And I think by the mere fact that, as Arden said, building a plane and trying to fly it, that's where we are with this new COVID. And there are a lot of people who have a 1,000 questions and don't know where to go. But if they listen to the show, they may be able to get some help in some direction. I also like the fact about Dr. Spade when she talked about the personalized medicine and then community partnership. I think that is so relevant today, particularly into where we are in terms of social determinants of health and how we go forward with medicine. You just can't just go in. You got to really know what the history or some history about the person that you're treating and care about it. So I think this is an awesome opportunity for all of us, and it's a great show. One of the questions that I did have for you doctors is that if you guys are on the research edge and a person comes a long haul or goes into their regular doctor, will they be able to get the same kind of, will they be able to get the kind of treatment that's going to be necessary for their continued health? I mean, is it something that you that's shared? Because I know not all doctors are equal. Like you say, some are pulmonologists, some are, psychiatrists, some are, medical doctors, ER doctors. Will the average person who is a long hauler be able to go to their doctor and really get the help they need? That's my question.
Reverend Perry, it's a great question. I think for the listeners of this show to know is that if you're experiencing symptoms weeks or months after you've had an infection with COVID, it's not in your head. It's not, hey, you're lazy. You need to, continue getting out there and exercising. So if that's the message that you're getting from your doctor or healthcare provider, then you need to kind of seek outside a second opinion. I think that there are a lot of good doctors. There are a lot of well-intended doctors in this community. In the coming months, I think there's going to be more guidance around how best to treat long haulers. But in the meantime, probably one of the most important things is being validated with your symptoms and having somebody, like you said, Reverend Perry, somebody who cares about your symptoms and who's willing to work with you through them, because we don't have, treatments right now. We don't have a set of best tools or practices on how to provide this, but you do need a partner who can help you work through the symptoms, try different things. If this doesn't work, try something else and really be supportive.
Thank you.
Excellent. Reverend Clayton, please share comments, your perspective.
Thank you, Tom and Dr. Vandergast and Dr. Spatz. It's been a wonderful discussion this morning. I would just like to tell the audience that this long haul symptoms or a long COVID, it's real. Two of my members who had COVID early on, and it doesn't discriminate with age. One, I think, is in his 70s, and the young lady is in her 30s. And they both shared with me, the young lady, she said, I was out of work for 2.5 weeks, and they asked me to come back, but I just couldn't keep up. She's a nurse, and they asked her, could she do an extra shift? I just can't do it. I can't make it through one shift. And this has been months ago. And the gentleman, I believe he's in his 70s, he's having a little trouble remembering certain things, but he was very sharp before, and he thinks it's due to COVID. And so these things are real. And not only are we talking about people in the regular area of life, they're professional athletes. I'm a basketball fan, NBA, and I noticed one of the players, he said, since COVID, he said, I just can't do 40 minutes anymore. So this is very real. And I think that the information needs to continue to go out so people understand that it's just not something in their mind, but it's a real thing, and they just have to take the time to get through it. And the only way that we can keep ourselves from getting this long COVID, as Doctor said earlier, is don't get COVID. So do all you can to keep yourself from getting the disease itself.
Tisha, just before I come to you, I just wondered, Dr. Perry and Reverend Clayton, Reverend Clayton and Dr. Perry, if you'd like to bring us up to date to some degree of what you might be working on now. Reverend Perry.
Yes, tomorrow, Tom, we have a pop-up clinic at our church, St. Stephen's. We didn't even publicize it, and we're already filled. So, and we have a lot of young people that are coming with their parents, which I think is awesome, because I think that's the next wave where we need to focus our attention. But I'm just so happy that, that we are at capacity just within 3 days. And it looks like all over, it seems like in Connecticut, there seems to be a lot of activity with people being able to walk up to these pop-up clinics, or these clinics being available in their area or where they live, so they don't have to travel far. It's awesome. And that's where we need to be.
Reverend Clayton.
Thank you, Tom. Yesterday, we just completed the second shot round of COVID down here in the south end of Bridgeport. And we will do it again on Tuesday, April the 27th, between the time of 3 p.m. and 7 p.m. And from ages 16 and up. So we believe that this will be successful, because the word is continuously to go out. But then there are so many people, as you stated with your friends, who do not want to receive the vaccine. So we have to continue to get that message out, the importance of vaccinating yourself. Why? Because you're not only protecting yourself, but you're protecting your family, and you're protecting people that you come in contact with. And all you got to do is, Yale has these pop-up clinics all over the state. You go to the website, and people can get right in. Might be a little patient, be patient. A lot of people are trying to get connected, but you'll get through.
Excellent. And Tisha, you mentioned that you had a comment.
Yeah, I just wanted to reinforce, I think Arjun made the reference to we're flying the plane and building it at the same time, and talking about some of the work and how fast paced the research has been in this space. But I just want to reinforce for the listeners that even though we're flying the plane and building it, the FAA rules are still in effect, so we still have all of I think it's just so important to, especially as you mentioned, that there's hesitancy about the vaccine. And just to remind the listeners again that there are so many safeguards. We've talked about them so many times on the show with the IRB, and there's so many safeguards that are put in place to protect individuals, that even though that the research has been sped up, it has not meant that we have cut any corners in bringing the therapies so far to the stage of EUA approval by the FDA, that all of these things were done because we were working around, researchers were working around the clock to get this work done. All of the protections were still in place. All of the regular review process of the FDA is still in place. It just that we sped the clock up with looking at the way that we do research and getting it done. But it was all still done in the same way and with the same regulatory and safety rigor that it was done prior to COVID. And as an example, just some of the research that Eric and Arjun are doing now, it's just we have a lot of other research that's been put on hold. So we're concentrating very heavily on making sure that all of the research is relevant for what we're doing now, but it doesn't mean that we're doing it in a different way. And I just wanted to make sure that the listeners understand that, not just for the participation, as Erica and Arjun have mentioned, to understand long hauler symptoms and make sure that we have diverse participation in those, but also for that we did have diverse participation in the vaccine studies, that all of the safety data and everything else, that the rigor around the understanding of the vaccine was just incredible, and probably larger participations and more views of this data than we've had in other drugs that have come to market. So we just want people to have confidence and safety in that. And really, like, everyone said, find that reason to get the vaccine, but don't let the deterrent, the speed, be the deterrent, because it was not compromised in any way.
Excellent point. Excellent point. And Dr. Venkatesh and Dr. Spatz, both of you have alluded to your research, but I think I want to kind of drill down again, even if it causes you to repeat what you shared before about a little bit about the research that you're involved with, because I want people to know how dynamic and active this brain meld, this investment of our brains are in terms of reaching a healthy solution for the planet.
Sure. So just to let people know about the project, a couple months ago, the CDC, so the government really wanted to help try to tackle this problem and learn more about this. And so they funded us here at Yale alongside 8 other centers around the country, all over the country, ranging from Seattle to San Francisco to LA to Dallas, Houston. And they've asked us to enroll almost 5,000 folks around the country into a study where we're going to follow folks for a couple years. There's no medications in the study or anything like that, but follow folks for a couple years to understand how long these symptoms from COVID last. It's a really interesting study because it is really partnered with patients to help learn from folks that are joining us in this study over the 2 years. It's, I think, on the easier side to do because you fill out surveys that you can do from your phone or your email. You don't have to, come in anywhere or park anywhere or anything like that over the course of the study. And we've got some good incentives for joining and being part of the work. But our hope is that over the next couple of years, that we can really partner with people, learn about their symptoms, and instead of being on a show like this today and saying, hey, we know that some people have brain fog, and we know that some people have chest pain, we know that some people have shortness of breath. I want to be able to get on this show and say, here's what we found. We found that for the people that have chest pain or shortness of breath, 85% of you feel better in 6 months. 95% of you feel better in 10 months. I want to be able to say that we found that the people who had some memory problems are different than the people that had shortness of breath. And maybe these are the kinds of treatments that may or may not help with that. And so I'm optimistic that we're going to be able to be successful in sort of bringing more light to this and really figuring out what all of this is. If you're listening and you're interested in joining, all you had to do was get tested for COVID. You don't even have to have had COVID. We're looking even for folks that tested negative for COVID but had some symptoms. And it's easy. Just go to the website. Our website's www.covidinspire.com. So that's www.covidinspire.com. And we are, open to any and all.
Excellent.
If the listeners don't remember that, they can also, the show is always posted on the YCCI website. So if you just go to the clinical trials website, the yalestudies.org, and select COVID, you'll be able to find the study there as well. So if they're looking to listen to the show again, they can just click right over from the show and find the Inspire study there as well.
Excellent. Dr. Spatz?
I think I just want to echo what Arjun said. I think that this studies will only be as good and as relevant to you, the listeners, as the people who enroll in the studies. So as Tisha Johnson was saying, one of the reasons why we have so much faith in these vaccines is that those studies did enroll diverse populations. They did the work. And we can say, as a doctor, I can say with confidence that those vaccines have been tested in younger and older adults, in Black and white and Latinx adults. And that is really important for having trust in the research. So now that we're on the side of actually conducting the research as researchers, our job is to really ensure that the patients, the participants in this research, are representative of the different backgrounds who we want the findings to be relevant to. So if you're listening, if you know of somebody who's recently tested for COVID within the last month and a half, we'd love to give you more information about the study and see if you might be interested in joining. It's a pretty easy study to enroll in. And I think I'm also optimistic about what we're going to learn and how this will advance our ability to take care of people in the recovery from COVID.
And Reverend Perry and Reverend Clayton, it might seem self-evident, but I don't think we can mention it enough. Your thoughts about why it's important for people of color to participate in these I'll say opportunities, not experiments, but opportunities for community better health. Reverend Perry.
Tom, thank you for the question. As always, I think that because African American, Latinx, and marginalized populations are sometimes the forgotten few or the forgotten many. And, you know, it just seems that if we are already down at the bottom of the ladder and everybody else is getting vaccinated at, you know, beyond, that makes this population even that more vulnerable. And so if medicine is to be valuable, all of the community must participate. It must be for all of us. And so it's very necessary for us to get this message out. And I think Tisha, by again reinforcing that it's safe and that this is not some fly-by-night, and by all of our participants here saying that, you know, this is something that you can't play with. It's important, it's urgent. And it's just very difficult to reach people who may have a different mindset with regards to their mortality. You know, we have a group of people who trying to just make it day by day, just hand to mouth, just you know, they're not concerned about tomorrow, and they're concerned about right now. So we've got to help them to think about tomorrow and to think about their legacy and their children, and try to help them realize how important it is, not just for the people at the top, but for all of us in order to go back to a sense of normalcy.
Reverend Clayton?
Yes, thank you again, Tom. It is so important that all people participate in the clinical trials. Even though we're all humans, there are some differences, and medications work differently in men and women, and those blacks and whites and Asians, et cetera. So if we want the medications to be effective in all populations, all people must take part in clinical trials.
We have about 3 minutes, and Harry, our station manager, will play the music. And I always push the envelope to the edge. So when the music starts, that means we've been bounced, because no one can hear us, but they'll hear the music. But I wanted Dr. Venkatesh and Dr. Spatz to give you kind of the chance for the last words and your whatever might be on your heart, mind, and soul, and just to share. I mean, I won't invite you to say a prayer, because you have two people on the program that could probably surpass us with giving a prayer. But when you think of the medical profession, that's, from my standpoint, that's a ministry in a real way. But not to put that label on you, but I just wondered if you had any last comments that you'd like to mention before the music starts.
I'll just say that, you know, thank you for giving us a chance to be part of this venue, part of this platform, and reach so many folks. I'm coming off of working all weekend in the ER. And so I'll be the first one to say that I know people have heard it a million times, heard it 100 times, but, you know, this is really a chance to take control of your health when it comes to getting vaccinated. Millions of people have been vaccinated safely around the country. It really works. I think we as doctors sort of undersell some of the stuff a lot of times, or we get people too caught up in some of the fears around it. And the reality is that we've got something really great out there. It can change your life and your family's life. And it's not about just getting vaccinated to be afraid. I think about the other part of my weekend, which was I dusted off the grill on Saturday and opened that up. I had a friend that went to a Yankee game this week. I am not a Yankee fan, but I would love to go to a game sometime this summer. And my cousin just decided to have her wedding in August. And to me, those are the kinds of things that is like what I'm looking forward to. That is getting back to normal for me. And I think that can be everybody's life. Just, go out and get vaccinated.
Dr. Spatz.
Thanks so much for having me on this show, for having Arjun, for letting us kind of give information to the listeners, but also hopefully convey a spirit of collaboration and renewal. I think that this pandemic for all of us has been deeply humbling. There's been a lot of suffering. And I think it brings out the importance of community and togetherness, whether, and we're facing those realities of what's in our community around racism, discrimination, health inequities. I think we need to own them, but we also need to come together to celebrate our wins and let that be the story and representative of the way that we move forward together.
Excellent.
In this new edition, filling positions, looking at the void in myself and feeling what's missing. Better watch the way you're going, better go in the right direction. In the moment you stressing, but you're gonna be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my